All right, today we're going to talk about caffeine, some of the uses, benefits, and risks, specifically as it pertains to athletes. We all tend to love and enjoy caffeine, and it is the most popular and widely consumed psychoactive drug in the world. It's been around since the Paleolithic era and has become integrated into daily life into most cultures. You'll find it in capsules, energy drinks, coffee, sports drinks, gum. It's known as a stimulant and used widely by athletes, so it's important to be aware of the effects and the recommended dosage. Like any substance, it can be safe when used appropriately, but toxic at high doses. So let's kind of take a closer look at how caffeine works. On the central nervous system, caffeine acts as a competitor with adenosine. So it binds to adenosine receptor sites, and adenosine is an inhibitory neurotransmitter. So it actually increases your feelings of calm, induces sleep, and decreases arousal. Caffeine does the opposite. It is a stimulant, so it stimulates the release of epinephrine and adrenaline, and as a result of this, it makes you more alert, more active and awake, less sensitive to pain, decreased perceived exertion. So caffeine has some significant effects on the central nervous system, and it can increase your heart rate. It has been measured as improving reaction time and metabolic rate as well. Now, on a cellular level, caffeine acts to increase the release of catecholamines on the cellular surface. And so that actually increases muscle glycogenolysis, which makes it so that the body will tap into those fatty acids as a metabolic substrate before glycogen. So it's kind of got a glycogen sparing effect. And it also increases both the muscle strength and power because of increased release of calcium and potassium across that sarcoplasmic reticulum. So as far as benefits to athletes, for aerobic performance, caffeine has been shown to enhance aerobic endurance specifically. So it can increase endurance by 10 to 20% when exercising at 85% of VO2 max. It also increases your aerobic capacity with a greater stroke capacity and higher tidal volume. Those who play team sports have been measured as having increased cognitive function. So this means that your reaction time and motor skills are enhanced. And it has been measured as improving power, speed, and agility, as well as endurance during time trial events. So as far as anaerobic power, it's a little more nebulous as far as the specific ways in which caffeine improves anaerobic power, but it has been measured as increasing isometric leg extension strength and producing more peak powers during high levels of exertion. It has one study measured explosive power increased by 1 to 8% in activities lasting 1 to 2 minutes. So it is a helpful ergogenic aid, even though all the mechanisms aren't quite understood. But one thing that they have consistently found is caffeine is more beneficial for trained individuals than untrained. Now, as far as athletes who benefit the most from caffeine, that kind of varies on an individual basis. So depending on metabolism and physiology, some people will experience greater effects than others. It seems to have more pronounced effects in men, but there's not very many studies on women, so that debate is ongoing. And women, specifically in teens, should make sure that they're careful with their caffeine intake simply because of a smaller body size. So we just want to make sure that caffeine intake is appropriate. So some of the disadvantages that can happen or side effects: caffeine can cause dizziness, headache, jitteriness, elevated resting heart rate, inability to focus. It is acidic, and specifically when in a coffee beverage, it can irritate your stomach. So that's just a few things to be aware of. And then as far as restrictions and regulations, the IOC doesn't currently have any specific regulations. They used to, but they still monitor caffeine intake in Olympic athletes. The NCAA limits it to 15 micrograms per milliliter of urine, which is the equivalent of about 500 milligrams of caffeine. The World Anti-Doping Agency doesn't ban caffeine specifically, but any IV injection or infusion is prohibited of any substance. And the FDA, allows caffeine up to 400 milligrams daily. That's about what's safe, and it's legal in foods as long as it's listed, but it can be listed as multiple sources. So that's one thing to be aware of. Low to moderate doses of caffeine, roughly 3 to 6 milligrams per kilogram of body weight, taken 60 minutes prior to exercise, has been shown to be the most effective. And then higher doses above 9 milligrams per kilogram of body weight is not necessarily any better. Chronic caffeine consumption can blunt the effects over time. So caffeine cycling or taking a break every little while for 10 to 14 days can help renew your body's response to caffeine. And then it does increase anaerobic strength and power, but we don't necessarily understand all the mechanisms by which that happens. So here are just a few references to make sure that you follow up on, read up on caffeine. It's important to know how it affects the body, why it increases your metabolic rate, how it increases muscular power, and then some of the limitations as well, so that we know, we want to make sure that we're within the recommended dosage, we're not taking too much. So anyway, read over those and just kind of take a look at how much caffeine you're ingesting each day and make sure you're within the recommended amounts.